on the board because we care deeply about health and care. I just need to get a drink because I'm going to start coughing. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been at the center of my work. I always ask myself, is what I am doing right for the patient? Caring for patients is why I started in healthcare. And caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our local area directors. In addition to myself, the board includes Andy Adams from Campbell River, Shawnee Cassavant, who's Opetchesett and Seychot, who is from the Opetchesett and Seychot First Nations, and Ann Davis from the Comox Valley. There are 5 other board members who are from the South Island area. Ron Rice, a member of Cowichan Tribes, who lives in Victoria, Anne McFarlane, Joanna Gislason, and Dr. Morgan Price, also from Victoria, and Harold Cull from Colwood. Our local leadership and executive management team members are also joining us, and you will hear from some of them as we go through the evening's program. We do have a full program this evening. Medical Health Officer Dr. Charmaine Nenz will speak about regional public health and wellness. And there will be a presentation from the John Howard Society of the North Island about the work they are doing around child and youth mental health and substance use in Campbell River. The last part of the agenda will be an opportunity for you, community members who have attended our meeting or submitted questions by email in advance, to ask those questions. And I will open the floor to those questions so the board can hear from you. But first I want to ask Marco Palahan, the acting president and CEO, to provide an update on the delivery of health and care services across Vancouver Island and Campbell River. Marco?
Good evening, everyone. Great to see so many people here. Sounds strange to hear the acting president and CEO. I am covering Kathy this evening and this week. She was unable to be here. Kathy McNeil as the president and CEO of Island Health, and privileged to be able to do that. My role with Island Health is I have the privilege to serve as the vice president for acute care and provincial programs. I also want to acknowledge with deep gratitude and respect the lands that we're joining on today. The Wiwikai, the Wiwikam, and the Kwikat First Nations, and a huge thank you to Elder Cheryl for opening us up in such a good way. As an organization, Island Health is committed to improving culturally safe pathways to care and providing safer care for communities. We at Island Health are here tonight not only to share information, but to listen to your experiences, to your concerns, and your vision for a health system that truly reflects the needs of our region. I want to start with something that matters to all of us. We know that accessing care here locally has been very challenging. Recruitment and retention pressures are affecting communities across Canada, including Campbell River. But I'm here tonight to share some encouraging news. Real, measurable progress that is already strengthening care in this community and will continue to do so in the months and years ahead. Since January 2024, Island Health has recruited 37 new physicians and nurse practitioners to this area. 2 psychiatrists have been hired, and this is improving access to mental health assessment and treatment. The hospital has added 6 emergency physicians, which is great to support ongoing 24/7 access to care there. Surgical and diagnostic capacity has been strengthened with the addition of a new orthopedic surgeon, a general surgeon, an anesthetist, and a pathologist. A new midwife has also joined hospital staff supporting continuity of maternity care, and we've also hired 2 new pediatricians. wanted to just take a moment to thank the new medical staff members who have chosen to work in this beautiful community and the impact that they're having and will continue to have on this generation and generations to come. Working closely with the Division of Family Practice, the community has also welcomed 5 new family physicians and 3.5 full-time equivalent of nurse practitioners, bringing the total number of primary care providers in Campbell River to 60. Primary care attachment in Campbell River is a real strength. Almost 83% of residents are attached to a family physician. This is quite a bit higher than both the Island Health and the provincial averages. Primary care is becoming more team-based as well. The Campbell River Primary Care Network now includes registered nurses, allied health professionals, and a clinical pharmacist supporting the 10 clinics in this area. This means patients can access the right care more quickly, whether it's medication advice, mental health support, or managing chronic conditions, all under one roof. On the nursing and allied health side, progress has also been equally strong. Campbell River Hospital has hired 75 new nurses, including 11 internationally educated nurses. Across Island Health, over 2,600 nurses have been hired between August of 2024 and August of 2025. Campbell River Hospital has hired 135 of these employees within the hospital, and another 113 have been hired to work in the community-based programs in this region. Recruitment and retention do remain challenging, but the momentum is real, and we plan to sustain it. These last couple of years of recruitment have been some of the best that we've experienced in the last decade as a health system, so really hoping that that's something we're able to maintain and continue. The momentum is vital. Campbell River's population to grow by over 90%. These shifts will drive sustained demand for primary care, seniors care, emergency services, and chronic disease management. At Campbell River, we continue to see remarkable resilience and growing efficiency and progress that is translating directly into better patient care. As the regional referral center for the North Island, the hospital provides specialized services. It supports patients from communities across a vast geography, enabling them to access higher level of care without traveling long distance. Across Island Health, successful recruitment in rural and remote hospitals has improved our vacancies from 17% to 13% in the last 2 years. Compared with other sites, Campbell River has seen the most significant reduction, from nearly 18% to under 10% overall vacancy rate in that same period. This is actually, our staffing is actually within Campbell River Hospital is actually the best out of any hospital within the health authority, and really pleased to be able to report that, but we still have a lot of work to do. For patients, this means more stability on the units, shorter waits, and greater continuity of care, with more staff available when and where people need them most. Even while operating above funded capacity, the team has reduced the average hospital length of stay through improved care coordination, new mobility programs, and stronger discharge planning, helping patients recover and return home sooner. The emergency department is serving an average of 90 patients daily and has recently reduced physician wait times, an improvement achievement in a community where many residents don't have a family care provider. The emergency department sees a wide range of patient volumes each day. About 11% of those patients need to be admitted. That equates to nearly 9 patients every day that require a hospital bed. However, this admission rate is lower than the health authority average of 15%, with some of our emergency departments actually having an average close to and above 20%. Surgical services continue to grow. Last year, over 4,000 surgeries were performed in the Campbell River, nearly a 9% increase over the previous year. The hospital is completing 74% of urgent surgeries within the 4-week target, which is 8% higher than the Island Health average. It has also significantly reduced wait times for non-urgent surgeries compared to last year. And we still have to do more. People are still waiting, often outside of that benchmark. Emergency mental health supports have expanded, including a dedicated mental health area within the emergency department and an embedded social worker who helps stabilize patients and support safe transitions home. I had an opportunity to speak to one of the emergency physicians that's practicing in Campbell River this morning, actually, and spoke about this person being in the emergency department and how that's changed his practice so he can have more care, the ability to provide quicker care to other individuals, and the care that social worker is able to provide is just immense. So these kind of changes, these additions to our multidisciplinary team are making a profound difference for the care that we provide every day. Campbell River is also becoming a regional hub for cancer care. The Cancer Care Clinic has seen a more than 25% increase in new referrals and chemotherapy appointments, enabling more people to receive life-saving treatment closer to home. Pediatric and maternity teams are meeting rising demand, including supporting more youth presenting with mental health concerns, a reflection of both community need and strong clinical capacity, and we're going to hear a little bit more from the John Howard Society on that work, the important work they're doing in the community in just a little bit. Last year, the hospital supported 358 deliveries, nearly one a day, with increased complexity, including higher preterm birth rates, ensuring families across the region can access specialized perinatal care. While pressures remain, particularly for patients waiting for long-term care or community supports, the progress underway is meaningful, sustained, and improving patient outcomes. This past year, Campbell River became the first hospital on the island to implement minimum nurse-to-patient ratios, one of the first hospitals in the province to be able to do that. As a result, we added 20 full-time equivalent positions, and recruitment into these roles has been very strong. We are already seeing the benefits. An increase in nursing hours means more support, more attention, and more time with patients. Significant reductions in overtime are helping create calmer and more stable environments, and a major drop in agency nurse use, including 0 agency nurse hours on minimum nurse-to-patient implemented units in the last period. Staff report that the new ratios have created more predictable workload, allowing for better planning and safer care. Patient satisfaction surveys are showing early signs of improvement, with more patients reporting that nurses have the time they need to answer questions and provide education. Even with high occupancy, often at above 120%, these gains reflect greater stability, stronger teamwork, and more time for direct patient care. Campbell River has a strong interconnected mental health and substance use network aligned with services across the region. People can access same-day counseling, case management, psychiatric care, rehabilitation, group programs, harm reduction supports, outreach, youth services, ensuring help is available close to home when it's needed most. But we know the demand is increasing, and many individuals and families are carrying more complex burdens. That's why Island Health is making major new investments to expand access and improve care for people living with mental health and substance use challenges. Beginning next year, we will launch Access Central, a new point of entry via a dedicated phone number to help people get connected to the right care without having to navigate the system on their own. This virtual access hub will help coordinate assessments, referrals, and transportation, helping people move more smoothly into detox, treatment, stabilization, and community supports. For patients, this means less confusion, fewer delays, and faster access to care they need from anywhere that Island Health serves. A key feature of Access Central will be new virtual substance use services, which will give people the option to receive support from home or within their own community. This will make care more flexible, more private, and more convenient, especially for people facing mobility, transportation, or stigma-related barriers. Another major step forward for Campbell River is the establishment of a local detox service. 6 new detox beds are planned to open by the end of 2026, creating Campbell River's first option and providing safe and supportive start to recovery. These beds will act as a bridge to a larger future facility with expanded detox and treatment capacity through the Road to Recovery initiative. Across the island, 19 new treatment beds will open in Parksville next fall, supported by dedicated transportation so that people from Campbell River and other communities can access this care regardless of where they live. All of this builds on a strong foundation that's already supporting people every day. 24/7 sobering and assessment beds, youth detox and recovery beds, an assertive community treatment team, crisis response, counseling, 5-day, same-day access for MHSU services, harm reduction outreach, and mobile mental health supports reaching Quadra, Cortez, Gold River, and other remote communities. These services ensure that no matter where people live, help is within reach. We are also making improvements across the community to reduce pressure on the hospital to help people stay safely at home. These changes mean patients can receive the right care in the right place and avoid unnecessary trips to the emergency department. Home support services are becoming more efficient through improved scheduling, updated care plans, better coding, and expanded roles for licensed practical nurses. For patients and families, this means more consistent visits, clearer care plans, and faster responses when needs change. Enhanced discharge supports, including liaison nurses, a rapid response case manager, and an embedded community health services social worker, are helping people return home sooner and preventing avoidable admissions. People experience smoother transitions, better follow-up, and more stability after a hospital stay. Rehabilitation services are also expanding with the addition of therapy services in the community that help people recover strength and mobility at home. At the same time, we're strengthening wound care, respiratory support, chronic disease management, and this is allowing people to stay safely, managing their conditions more confidently, and stay independent longer. A major development is a new long-term care home planned next to Yakulta Lodge and the hospital, an important step for seniors, families, and this entire community. The project, now in its design phase, will add approximately 150 long-term care beds, addressing one of Campbell River's most significant challenges, the shortage of safe, appropriate places for seniors who can no longer live at home. We recognize that this project has been delayed, and like the community, we want progress to move forward as quickly as possible and working very hard to be able to achieve this. Construction is anticipated to begin in late 2026, bringing us closer to greatly expanded capacity for seniors who need dire around-the-clock care. Across all of these initiatives, the goal is the same: stronger community support, better coordination amongst care teams, and better outcomes for patients and families, whether they are recovering at home, managing chronic conditions, or planning for long-term care. In a time of global and local uncertainty, it's more important than ever that we stay grounded in our purpose, the people we serve, the teams who deliver care, and the communities who place their trust in us. Campbell River is showing what is possible when dedicated professionals, strong partnership, and a resilient community come together with a shared goal. Our vision at Island Health is simple: excellent health and care for everyone, everywhere, every time. And we know that we aren't perfect in that vision. But this vision guides everything we do and every improvement we're making here in Campbell River and across the island. I want to thank the care teams who make this work possible and the community for your honesty, partnership, and determination. Your voices and your commitment are shaping the future of care in Campbell River. Thank you for your support, and thank you for the opportunity to keep building this future together. Thanks, everyone.
Thanks, Marco. You know, when I'm going to introduce Dr. Charmaine Enns, I just keep thinking about how important public health is to us and how we got clean water and vaccines, and the list goes on. And because hospitals take so much attention, we forget about all those great things we got from public health that make us so much healthier. So I'm really pleased to have Medical Health Officer Dr. Charmaine Enns here to provide an update on health and wellness of the Campbell River population. Dr. Enns.
Good evening, everyone, and thank you very much for that introduction. I appreciate that. I'm a big fan of Leah's. I can't hide it. And I'm very grateful for all of you who are here this evening and for the chance to share some important information on the health of the population which if you could just bear with me for a second, I'm just going to, because I don't want, there we go. I have just a few minutes to share with you some indicators on the general health of the population. Recognizing, and I'm thankful to both the territorial acknowledgement that you provided at the beginning and to the elder for welcoming us in a good way, to acknowledge where we are in the homes of the people that have been here long before us, and I'm grateful for the opportunity to participate in this. So we're talking right now about Campbell River, and you're going to see on the small picture, that's the local health area. We call that the Greater Campbell River area, and then the smaller insert is more the city of Campbell River. So I'm going to be referring to both of these areas as I provide some of this data. What I want to explain, though, is I have just a few indicators to show. They're very high level, and it doesn't represent everybody. So I recognize that not everybody's going to see themselves in the data. That doesn't mean that you're not important. It just means that I had to select a few indicators to give some high-level story on the health and wellness of the area. So population demographics, this is a population, the Campbell River City area is just under 39,000 people. What's important in that is that when we project out for the next 20 years, the growth, the modeling or the growth that's anticipated in the city is only, it's about 8%, which is about half of what's projected for the rest of the island. The highest proportion of the age in the population is 20 to 44 years of age. That's about a third of the population. Median age is 46 years. Approximately 13% of the population identify as Indigenous. When we look at some socioeconomic factors, so what we're comparing here is the 2016 and the 2021 census data. So the amount of people who rent, who spend more than 30% of their income on shelter, has gone down from 2016 by 5%. The people who own their homes and spend more than 30% to have that home, that is changed a little bit. It's just under 15%. The important thing here is that renters, twice as many renters than homeowners, spend more than 30% of their income to be able to afford to live where they live. The median household incomes have gone up slightly. Okay, I should say progress, shouldn't I? Or next slide. You're on it, okay. The median household incomes have gone up slightly from one census to the next, but this is less than the island and the BC median household. So that's important. And the number, I think this is an important indicator of that the population aged 25 to 64 with post-secondary training is actually very high in the region. It's almost 58%. That's something to be proud of. Life expectancy at birth. So we have a challenge within the region in terms of life expectancy, and life expectancy within this region is 79.5 years. Now this is an average, of course, and when you look at it compared to Vancouver Island, which is 81.4, and all of BC is just under 83. But what I want to point out is that line for Greater Campbell River, it's going down. So then of course the question is what's influencing or what's impacting life expectancy? And to look at that, we talk about something called potential years of life lost. So that if you live to the age of 75, as the age, the goal, and any premature death before that, that adds up to something called the premature potential years of life lost. And it helps us identify factors that are driving that life expectancy that we just saw. So I just picked 3 indicators from the potential years of life lost that I thought you would find interesting. And the first is that within the region, almost twice as many deaths contributing to the potential years of life lost. So the younger you are when you die, the more it contributes to this indicator. It's almost twice as high compared to BC for accidental poisonings. When you look at self-harm and suicide, it's 1.4 times higher. And what's interesting for motor vehicle, which I wasn't expecting this, is it's actually about half for motor vehicle crashes and accidents, but motor vehicle also includes pedestrians. So when we just look a little bit more at this, I just want you to show you the accidental poisonings, how that's coming up off the graph very fast. And you can see that it really starts in about 2015, 2016. These are 5-year aggregates, so it kind of ramps up slowly. A huge contributor, of course, not unique to Campbell River, but especially impactful here in Campbell River, is the deaths related to the drug poisonings with the unregulated drug supply. But this is also driven by alcohol. So there's 2 very important substances that are contributing to the accidental poisonings. So when we look at substance use, 30 people up to the end of September in 2025 have lost their lives due to the unregulated drug supply. This, as terrible as that is, it's 50% better than last year. So last year in the region was a very terrible year for these deaths, and we are seeing a downward trend, which is encouraging. But it is important to also recognize that the rate of drug poisoning deaths in the region is over 2 times higher than the rest of Vancouver Island. Most of these deaths are in males. Most of them are 25 to 44 years of age, and most of them happen in private residences. They're not the people that we might assume sometimes. So a substance use overview, just quickly to say that when we look at hospitalizations, the highest rate of hospitalizations for any substance is alcohol. And within the region, it's 1.4 times higher here for admissions directly related to alcohol, and almost 2 times higher compared to BC. The green line, you can see how alcohol admissions have crossed now the line for tobacco. Tobacco's going down, but that's a bit of a blip. And then we have opioids on the bottom. Substance use, alcohol is a very significant public health issue, not only within this region, but across Vancouver Island. I will say it unashamedly. This is a factor that we have, a substance we have normalized into our communities as a way to celebrate and connect, and it's killing us. So how much can I do to get this message out as a public health doctor? I'll do it till I retire. But just so that people have informed consent, I just really want the population to know that this is not a benign substance, and that we can connect and have a relationship and fun without it, especially as it relates to our youth. When you look at the average consumption within this region for everyone 15 years of age and older, so that includes a population of people that aren't even legal to drink yet, that the average weekly consumption of alcohol per standard drinks is 15.5 standard drinks per person per week within this area. The new guidance we have in Canada in terms of alcohol consumption tells us that 7 or more drinks per week for any individual puts you in the high-risk category for serious outcomes, including cancer. So these are effects that aren't going to be in the moment. They're going to take time to develop. But for women, we have to be especially concerned about breast cancer, but there's also multiple other cancers, including colorectal and throat and stomach. But then there's also all the other chronic diseases, and then there's the harms that happen through poor decision-making, impacts on the people in our lives, lost productivity. So there's, and the impacts, of course, on the police force and the judicial system. So trends in chronic disease, I really don't find this one very interesting. It's kind of there. Like, you know, the biggest issues are hypertension and issues with mood and anxiety, which is not uncommon for any of our communities. I just want to say the hypertension line with the big blip there, that's a coding issue that's happened across the province, so that will stabilize out. But I think it's important to recognize that mood and anxiety are really important issues in terms of wellness, and not helped by alcohol, I might add. So just for us to be cognizant of our total health and wellness includes all of us, which is, you know, our minds, our hearts, our bodies, all of that. So when we do a quick survey in Campbell River in terms of what's going well for you, I just want to report that what you've said is that 85% of you say that you have a regular healthcare provider, that's great. That's better than, like Marco said, that's better than in BC, the average for BC. 12% report most days to be quite stressful or extremely stressful. That's a negative indicator, but it's actually positive because it's much higher in the rest of the province. It's closer to 20%. 62% of you report 2.5 hours of physical activity every week. Again, better than the average. And 38% report eating that nice variety of fresh fruits and vegetables. I just quickly want to finish off by talking about climate change. Why not? So this is an important thing that's impacting all of us. And there's a number of things to be aware of so that we can adapt appropriately. The name of the game is going to be adaptation. So when we look at temperature change, this here is looking at the temperature days above 29. Why 29? Because we start seeing health impacts that affect people, especially people with underlying chronic diseases and the age extremes, for being more vulnerable to those heat, and especially if the heat is sustained, and especially heat that's sustained overnight. That's when the real dangers happen for people, is when we can't cool off at night. So this just shows from 2012 to 2025. It's not a dramatic, obvious trend, but it is an upward trend over time in terms of the number of days that are hot. And when you model out what to expect, there's going to be more hot days. The hot days are going to be hotter than they were before, and the nights are going to be hotter. That's the bottom line. What does it mean for precipitation as we look at modeling out for what's happened and what's going to happen, what we expect to happen as it relates to climate change? We're going to have more rain. Not a surprise. We're going to have more rain in the wet season, and when it rains, it's going to be more rain, and we're going to have less rain and drier in the summer. Why is that important? Well, we need rain. We need the moisture precipitation. We need our water tables to be appropriate. We need our water reservoirs. We need our drinking water for quality, for potability, for drinking and cooking, but we also need it for everything else in our lives. And if we don't have rain, we have drought. And we have had a number of years of drought on drought in BC. So even when it feels like we're getting a lot of moisture, we're not replenishing our water tables. So we still have drought on drought. And this is just to show, when you look at East Vancouver Island, which surprisingly West Vancouver Island looks exactly the same, you can see that we have at least 3 months a year of significant drought now within the region. So adapt. We're going to adapt. We need to adapt. We all need to adapt. The good news story is Campbell River has a lot of leadership, and the Strathcona Regional District, tons of leadership as it relates to climate change adaptation. And I just want to give a shout out. There's so many people doing such good work, but Sean Koopman from the SRD and his leadership to help support communities with their initiatives for adaptation has been a really remarkable thing to watch. And so I just put on here some examples just to say, well done. City of Campbell River and Strathcona Regional District across multiple areas and important issues for adaptation, and then specifically to communities. So the key messages: you've got some very encouraging trends in social determinants. The decreased and lower life expectancy is driven by preventable factors. So we can do something about that. So that to me is the good news, in that we can do something about it. And climate-driven hazards increase health impacts broadly. And so those strength-based, community-led approaches are being done and are starting to address those challenges. And from what I see, I have quite a bit of confidence that those initiatives are going to be sustained. So thank you very much for giving me a chance to give that story. Okay.
Well, I have to say I'm always shocked. I listen to you every time we have a board engagement, and I'm always shocked. So it's a good thing that you shock us, I think, given what you've just said. So we're now moving to a presentation from the John Howard Society of North Island and the work they're doing here in Campbell River and surrounding region. And it's my pleasure to welcome and introduce Tyler Feinstadt, Executive Director of the John Howard Society of North Island, and Chris Bennett, Manager of the Society's Foundry and Community Programs in Campbell River. And just before you gentlemen start, I want to note to the audience that I will give the board an opportunity to ask questions of these two gentlemen before I turn it over to the audience. So please.
Well, thank you so much for the opportunity to come and present today. And in particular, want to say thank you to Brennan McDonald and Shauna Zeal, who have just been the most incredible supporters of our organization. They oversee all of our contracts from Island Health and just been such great champions for us. Yeah, so my name's Tyler. I actually moved here just over a year ago, and I'm happy to say that I brought a doctor with me, who's my wife. So we're +1 family doctor here on the North Island. So I'm just going to give a very, very quick overview of our agency, and then I'm going to pass it over to Chris, who will be able to tell you in much more detail about some of our programming here, here on the island. So I've actually had the privilege of leading 3 different John Howards, 2 in Ontario, and then this one here on the North Island. And each John Howard is very, very different. So here on the North Island, and we're a little bit outside of the norm for John Howards. Normally people think John Howard, they think prisons and men. We deal with youth. That's really our focus here on the North Island. And as you'll see in kind of our demographic snapshot, our folks come from all genders, walks of life, etc. So we've been here for a long time. We were founded here on the North Island in 1967. So have long, long roots in these communities. And we're actually across 13 different locations here on the North Island. So we are primarily here in Campbell River and in the Comox Valley, but we're also have small teams in everywhere from Port Alberni to Port Hardy, all the way down to Nanaimo and Duncan. We have 107 staff and 11 incredible care homes who are very much a part of our organization as well, and house our youth who are attending some of the programs that Chris will tell you about. We have a budget this year of about $11 million, so we are a fairly large agency for this part of the country. And just also really wanted to highlight, I think, our strong history and connection with the local Indigenous nations. We have an Elders Council who really drives our organization. They're there at every level from the front line all the way up to governance in our organization, and that's really a commitment and of enormous importance to us as an agency. And yeah, I'm gonna pass it over to Chris. We have a very short window to present a lot, so gonna pass it to Chris to give you maximum time. And then I'm gonna come back at the end for a very quick wrap up. Yeah.
Brilliant. Thank you, Tyler. Yeah, as Tyler said, there's a lot of content to cover. I'd like to just chat about some of the programs that we have running in Campbell River. I'm the program manager for Foundry in Campbell River and a number of our community programs, many of which are listed here. These are our Island Health contracted programs, and several of those are actually really strongly integrated with our Foundry model as well. So example is our substance use program and our primary care. So I'm just gonna start to talk about our 180 program. So in 2016, you can flip to the next slide. Is that one? Yeah, great, perfect. In 2016, we really recognized the need for a more robust model for supporting youth with mental health concerns and mental health issues. And that coincided with a chunk of money that was becoming available with Island Health. And we were able to partner and develop the 180 program, which is a 5-bed care home model. So we have youth that come from all over Vancouver Island between the ages of 12 and 18 to receive substance use counseling. They're able to stay in Campbell River for up to 6 months. It's totally voluntary. And they live with care homes, so it's basically a family model and wraparound service. It's an amazing program. I'm so proud of that. I spent many years of my career working with that program, and it still continues to thrive and provide great supports for young people. it works with the biosocial spiritual model. We use DBT, CBT, and it's embedded with the circle of courage model as well. And so we really try to recognize the strengths of the youth that we work with in that program with that Indigenous lens as well. We create environments that are culturally safe and really supportive of youth to address the basic needs that they have when they come into programs. So it's a beautiful transition from, they come in and we give them lots of time to settle in and get comfortable to do the work. We have 4 counselors that can support those clients, 1 substance use counselor, a full-time teacher so that kids can continue to do school. Excuse me. And we have transition counselors who do a beautiful job of supporting clients before they come into the program and helping them exit into their home community as well, which has really been a game changer in that program. And there's a real emphasis on trauma-informed practice within that program as well. So, next slide. So more recently, we've had connection with the primary care network, and we now have, as part of our Foundry services, a nurse practitioner who is full-time that sees clients Monday to Friday. A lot of the clients she sees present with mental health concerns, which, as we saw from the previous presentation, we're just seeing really high levels of youth mental health concerns. So this is such a foundational part of the Foundry service where we can provide counseling, access to peer support, but also that primary care piece, which is so important. And primary care also helps us do referrals into psychiatry. We have Dr. Williams who attends Foundry every other week, and our referrals can come from our mental health counselors, as well as we have a social worker who works full-time directly with our nurse practitioner, and so they can support PWDs, connections to other community resources, as well as just connecting to other resources in community and family supports. You can flip to the next slide. Yeah, another really strong integrated program with the Foundry is our substance use team. So we have 1 full-time counselor and 1 half-time counselor. The half-time counselor actually splits their time between the 180 program and with a community program. So it's a really nice blend. It's a beautiful bridge between those 2 programs. They offer a lot of group work, so programs like Smart Recovery. They do a lot of work around harm reduction and really addressing those mental health concerns that lead to substance use. A real emphasis is on that early intervention and prevention. So all of those stats that we saw, we're really trying to intercept those before they become problematic for our young people. And our substance use counselors do a really great job of addressing that at the ground level. The great thing about that program too is it's very malleable. We can see clients wherever they're at. We go into the schools. We have an office actually at Rob Braun Alternate School. So youth don't have to leave their classrooms. They can basically just walk down the hall and not have to leave school. They're right there. But it's also a really nice way to transition youth down to the Foundry where they can access other supports. It's just a really nice, smooth model. Okay. Yes, and we also have Island Health funding for support in Gold River. And Gold River is a community with some really unique challenges. I think just with the isolation of that community, with some of the social issues that are happening in that community, they don't always have a lot of support for young people. There's not a lot of activities. And most of the services that are out in Gold River actually travel from Campbell River. So agencies like Family Services and Child and Youth Mental Health have workers there once a week. We're really, really fortunate to have funding that we have a full-time counselor in Gold River who sees kids in her office and also within schools. She also travels to Tassis once a week and sees the youth at their schools. One thing I didn't mention about our substance use counselors as well is that we've recognized that youth are starting to use substances earlier and earlier. We can now, previously we were seeing kids starting at 12, we now see them as young as 10. And we're getting a lot of those referrals. It's amazing that that's how young it's starting, but we're seeing it really emerge. So very similar in places like Tassus and Gold River. Use is starting earlier, and Flossie, the full-time counselor, is able to see those clients. This is also a really great example of how responsive our connection to Island Health is, and how much we appreciate that partnership. In the summer of 2024, there was some reports of some real concerning youth behavior and some substance use issues, as well as some mental health. Lots of kids were reporting suicidality, and they didn't really know what to do. And so we were able to chat with, I think it was Brendan at Island Health, and we were very quickly able to put together a half-time peer support position. So since the fall of that year, we are able to have a half-time peer support worker who, non-clinical, but is there just to be that support person, to connect them to resources and community, to make those bridges happen between our agency as well as those other community partners that travel to Gold River. And I think the biggest part of that is establishing some groups. We know that mental health comes from connection, and establishing really strong peer groups and having that worker out there has been really amazing to see the change. And it's still early. There's still a lot of work to do in Gold River, but these positions have been so important to creating some of those pathways to really strong connections. So that's been fantastic. Next slide. Yeah, we also have in Campbell River again, early intervention and prevention worker who travels to our elementary schools and our middle schools and high schools to provide substance use education around harm reduction, and talks a lot about other resources that youth can access in Campbell River as well. So it's a really strong emphasis on giving kids the knowledge around alternatives to substance use, talking a lot about pro-social activities that can help reduce anxiety, but are also going to use up their time, so they choose to, do an alternate to, smoking, marijuana or whatever they do in their free time. And then our outreach worker, she is fantastic. She comes from a real mindfulness perspective. She connects with youth who have anxiety, mental health issues, substance use issues, or are affected by sexual assault, and provides a safe place to land. She's really connected to the environment, so she takes kids out into the forest. She'll do mindfulness practice, yoga, and she's also creating really beautiful youth groups where connection is sort of that primary focus. So it's a really great work, and I'm really proud of all of the work we're doing that we really couldn't do without our partnership with Island Health. So it's amazing. Next slide. Okay, future focus. Do you want to take this?
Yeah.
Yeah.
So maybe just a couple minutes about, or a couple seconds about where we're sort of going in the future. So I think for us, the number one need that is showing up for us is housing for youth. Should not be surprising at all to our friends in public health, but it is really, we just undertook a pretty extensive youth housing needs assessment here in Campbell River. And the situation for youth for housing is, it's terrible everywhere, but it's especially bad here in Campbell River. And so being an organization that's youth focused, that has some capacity and some roots in the community here, we really want to step up and see what we can offer in terms of some youth housing solutions. The closest youth shelter to here is in Nanaimo. So there's just some enormous gaps with youth housing. So that's really where we're going. And then as well, it's really continuing to deepen our relationship with our Indigenous partners. We have some great stuff to build on, but I think there's so much more we can do in kind of centering culture within our work. And then the last thing is, I think, just increased presence in the community. I think during COVID, a lot of the agencies kind of got stuck behind their walls, and I think we really need to get back out into the community and get connected. So that's a big focus for us as well going forward here. So I think that's it. Thank you.
Well, thank you very much for caring so much about the youth in our community, and it is with immense gratitude that we thank you for the work you do. I just want to ask my board colleagues, Anne?
Thank you. Thank you for a great presentation. Having worked in community social services for a long time, I'm very aware of the work, the really fine work of the John Howard Society and what leaders your organization have been in weaving cultural supports into programs. I just wondered about the care home model when kids come in for up to 6 months to live in a care home. Are you able to make connections for those youth when they go back to their home communities? Because I think that's a place where things can kind of fall apart. So I'm just curious about whether you're able to do that.
Yeah, no, I'm happy to speak to that. That was really one of the things early on with that program that we recognized was problematic because kids would go home and they're going back to the same environment. Their families maybe haven't changed, but they have. And so we were able to create the transition worker position. And that role was not just to support kids to come into program, but there was that transition back into home community. And so working with the families, working with community partners in their home communities to not just do a soft handoff, but talk specifically about what they've been working on for the past 6 months to share that knowledge so it can continue on. And yeah, it was a really important piece to the program. But thank you for that question.
Anyone else from the board want to ask a question? Then can I turn to the audience then and see if there are any questions for either Chris or Tyler? We have a mic, a roaming mic, if anyone wants to ask a question.
I don't have a question, but just thank you guys for all the work. So I'm Tennille. I have a lot of hats, but this one is I'm one of the 11 care homes that they spoke to. We've been caregiving for over about 8 years, I guess, since before my first daughter was born. We had our first placement, and it's an amazing program. It's one of the only programs of it in the province, very few in the country, that does this work for our young people. So if you ever get an opportunity to support the work that they're doing, expand funding, it really does make a huge difference to some of these kiddos. And they come from all over the place. And for our family, I mean, it does wonders for my tiny humans. And my tiny humans do wonders for the teenagers that come, because my eldest is a social butterfly, and as soon as a new kiddo comes through the door, that's her new best friend. And she pushes those boundaries with those young people so hard, reading books and playing dolls, you name it. So it's an amazing opportunity to be a part of that program. And if you know of anyone that is thinking about it, it's a great entry into learning what it's like to have someone else's child come and stay with you. A very soft, warm, welcoming, inclusive opportunity to do that work. Yeah, so just wanted to give you guys a shout out. Thank you.
Well, thank you.
Could I just add something quickly? you know, when I was learning about John Howard North Island and making the move here, the care home model was the thing that I found most exciting, because it's a way of deeply engaging with the community here and also being able to look at where each youth will be successful, right? What will be the best match for them? And I will say a lot of the programs across the province have really struggled with recruiting care homes, but we have not had that problem to such an extent here in Campbell River. We have an amazing roster of care homes who've been with the agency for a long time and are just incredible, incredible people and do such great work with the youth. Yeah.
Great, thank you. Are there any other questions? You know, one of the things I liked that you said was kind humans. We really need to be kind to each other. We find ourselves in times that are pretty tough for a lot of people. And so being a kind human, I think, is a characteristic that we should all highly value. Thank you very much for coming this evening, and thank you again for the work you do. I guess I can just stand here and do this because I have a mic. There you go. So I want to open the floor to questions from the audience. I don't think we have any questions that came in via email. So what I ask is that you keep your questions as short as possible, and we'll try to answer as many as possible before we adjourn at 7:30. Here's the roaming mic coming to you.
Thank you. I was just wondering about the province's approach to obesity and childhood obesity, with our rates being over 30% and the issues it can cause physically as well as with mental health. Why is there not as much of a push for dealing with obesity rates in the province as compared to some of the other items that you had brought up tonight?
I'm looking at one of our medical health officers to see if they want to respond to that question.
Rika, do you want to introduce yourself when you speak? Thanks.
Hi, I'm Rika Gustafson. I'm the Chief Medical Health Officer for Island Health, and Charmaine's friend. And with respect to prevention of obesity, one of the biggest things that we are trying to do is, so there's a number of sort of specific public health programs that are related to food security and food skills. But we know that really the biggest issue is the fact that we're living, the two of the biggest issues are poverty and that we live in an obesogenic environment. And those are really public policy interventions that aren't necessarily within the purview of a single healthcare provider. So I would say that there is actually quite a lot of effort to address physical activity and sort of individual level interventions, but it's a really, really hard thing to do to prevent obesity. And I think one of the things that we need to recognize is if you look at the trends in obesity and the trends in the creation of an obesogenic environment driven by commercial interests, that's probably the thing that we need to address more as a society than as a healthcare system. Charmaine, do you have anything smarter to say?
Does this one work? Oh, yes, it does. First off, I'd like to thank the gentleman from John Howard Society. Your program really speaks to my heart, particularly the youth. Spent too many years dealing with that in our family, unfortunately. Luckily, successfully, certainly in one case. The one thing, and I also want to congratulate Campbell River Regional Health Area. Certainly all the accomplishments in terms of recruiting staff, everything that you talked about at the beginning. It was absolutely fantastic. However, here comes the tough part. I'm a bit of a single issue candidate right now. And I'm very concerned for one issue, primarily because my father died of a heart attack, is cardiological care, Central and North Island. And so I've been watching in Nanaimo and everywhere, trying to see what we're going to get, if and when. And last year, about this time, I was very happy when KPMG was engaged to do a study. and the anticipation that that would make some recommendations, et cetera. My understanding, or at least I haven't seen anything where that report has been released or discussed. You know, I used to actually work for their precursor. I'm a really old fart. I worked for Pete Marwick, and that became KPMG. I also did a lot of consulting, so I know, you know, consultants are paid to write the report that their employer wants. Anyway, I'm curious, the report hasn't been released, and I've been waiting for it to see, and I'm sort of, oh, please, you know, it's something that really needs to happen for Central and North Islanders, because heart and stroke, they're one of the few diseases where you die quickly, within an hour. Cancer, terrible, et cetera, but heart and stroke have to have prompt action, and you need access to a cath lab. And so I've been waiting for the report. I've been waiting to see some discussion from all the stakeholders, what's going to happen. And 2 days ago, a friend of mine who is getting pacemakers, different things done down in Victoria, told me that his cardiologist was very happy because he had heard that there's going to be a new cath lab procedure room in Victoria, and that Island Health had somehow found the operational funding to see that happen. And that's great. You know, I know North Islanders can get there and use that service, but it's more important that we get there within 90 minutes, and that's not going to ever happen by a helicopter, by car. We need a cath lab. We need that kind of quick access in the North Island. So thank you very much.
Yeah, thank you, sir. Really appreciate the question. And this is a real serious issue for anyone that's living outside of Victoria. You referenced that KPMG report. That report is just in its final approval process within the Health Authority, and we've already started sharing the draft version of that with our physician interest holders in and around Nanaimo and other parts of the island, including internal medicine leadership from every hospital on the island as part of that. That report and the intent behind it was to have to look at our population health data, to look at our data and identify where our gaps are and where we need to grow. So that report, just to give you some early indication of what it's showing, and you may have heard this from some of the physicians that you might be colleagues with, or some other members of the community who've already seen the preliminary version of that report. It's clear that there's many services that we need to grow within the Health Authority and meet demand and bring closer to home. Cardiology is definitely one of those, and definitely access to cardiac catheterization when somebody's having a myocardial infarction, being able to just have diagnostic treatment, being able to have cardiology follow-up post-procedure or post any type of cardiac event is also important, and that's part of that comprehensive plan. And this plan lays it out in a way that we just haven't had before. So it clearly identifies what our roadmap is, what we need to be able to do to get there. Part of that plan also indicated the need to expand services immediately as soon as possible to deal with wait lists across the region, and had some expansion considerations for Victoria. The cardiologist that you mentioned, that I'll state a fact here that is actually not an approved plan as yet. It's been brought to myself and my colleague Dr. Williams, the Chief Medical Officer and VP Medicine, and so we're aware of that, and we're working through an approach to be able to fund that. But it actually is not formally approved. It's initially there in concept. The primary function of that addition will be as a device room to increase pacemaker insertion because we have a quite growing wait list in that area across the health authority. And the intent is to operationalize a previously functional room. So the room was at the Diagnostic and Treatment Center at the Jubilee when it opened in 2001, was actually a functioning device room, and it's intended to return to that. So it will not require any construction costs. So just to share that, and it will not impact the plan to grow cardiac services as we very much need to in other parts of the island.
Thank you very much. You know, certainly you've confirmed what I had heard. I guess the word is out there amongst South Island cardiologists that, hey, we're getting something maybe. But you mentioned a bit of things about cost. And down in Nanaimo, I heard, very heartening, that the regional district, they've already set aside $100 million. I heard that the full catheterization lab would cost something like anywhere from 40 to 50 million. That's sort of one estimate. Maybe it'll go way higher. But it's a much shorter project than a big hospital. And the regional district having that 100 million, I heard, what's her name? Janice Perino spoke at an event, and she said that they would advance 100% of the cost up front to relieve some of the, or that was her position. I don't think it's an official position, just like your cath lab isn't an official position yet, which is very heartening. So hopefully that money won't sit idle while people die en route. So thank you very much.
Yeah, I think the support from the regional hospital district, as you mentioned there, sir, is immense, and absolutely we would need that to advance, and really great support from the Fair Care Alliance as a community advocacy group. So just to say, there's a lot of community support for this, and how we get there is going to be key, and how it sits. The conversations that we're having with our health authority and with physician leaders and leadership there, including Janice and other interest holders within the community, is part of the master site campus plan that we also hope at some point in the future will include a tower, and it will include other upgrades to the Nanaimo campus, and part of that would be cardiology services. So it's part of a suite of services that we're definitely interested in exploring and advocating for in future. So thank you.
Thank you. Could you just bring, yeah, great, thank you.
Thank you, and thank you for this opportunity at this forum to raise questions. My name is Fran Ferguson, and I'm a registered clinical counselor in private practice with 25 years of experience, recently retired. I have a particular interest in dementia and in compassionate and appropriate care, both for people who have been diagnosed with dementia and their spouses and the unique, unspeakable burdens that they carry. The need is urgent, and we have heard very little about long-term care, about nothing about dementia tonight. So I just feel the need to raise it as a topic of conversation. So I have several questions kind of related. I understand there's about 85,000 people in BC who are living with dementia, and those numbers are expected to triple in the next 25 years. So naturally, I'm curious, what are the numbers in the North Island, and do we know those numbers specifically for Campbell River? Related, dementia is terrifying for most people, so we duck it until it's in our face. From other reading that I've done, I know there are things that we can be doing to reduce the possibility of getting dementia in the first place. Caregivers are overwhelmed, exhausted, and isolated. They're also pretty invisible. And many are forced to tackle many major challenges on their own with very little family support, scrambling to learn about dementia and what help is available. And sadly, from my own experience, the help that is available in our community is woefully lacking. Those caregivers are at risk for their health and well-being, with spouses, this would be me, at 6-fold increase of getting dementia themselves. So my question is one for all of us, and particularly Island Health. How can we, as a community, better support caregivers, better support people living with dementia, particularly spouses? I was excited to hear that there's a plan for new long-term care facility in Campbell River. I am quite disappointed to hear that it's now delayed again. What I had read is that the construction would have been this year. However, I guess you said it's in the design phase. I'm wondering if there will be opportunity for public input. I become keenly aware that the needs of people living with dementia are quite different from many of the people in long-term care. So I have a personal interest in seeing those are met. And finally, as a spouse who's experienced it from the inside, it's been quite a heartbreaking experience to be working through the system with my husband, who passed away this year. I've seen quite a bit, and I have experienced quite a bit, and I have some very practical, concrete suggestions. I want to be part of the solution. I want to be part of positive change that's so desperately needed across the country, and especially in our home community of Campbell River. So I guess part of the last question with that is, how can I contribute in a meaningful way towards change and providing the supports and education for our community?
Thank you. Really, really great question, and just start by thanking you for your work as a community counselor, and sorry to hear about the experience with your husband. Dementia care is such a vital part of the work that we need to do every day, and we talked about long-term care, 150 beds. It will never touch the demand that we're going to have in this space. I mentioned the growing population that we have, particularly in 75 plus. So this is definitely an area that we're going to see increased need over the years. I talked a little bit, maybe I'll just mention a few more things, and I might ask one of my colleagues to also comment and add some additional pieces. But as part of what I mentioned earlier as well, this is one of our most rapid growing areas, actually even more than even hospital care, is in community-based services, providing care closer to home. One of the indicators that we follow is caregiver burnout, and its impact on what the trajectory of an individual could be is obviously really dependent on a caregiver. I think that's a lot of what you were saying there. So how you can be involved? Well, we have patient partner opportunities within the health authority. This is definitely an area that we need to do more on. So perhaps there's an opportunity for you there to become an interest holder with us. In acute care, in the last couple of years, as we continue to implement our electronic health record, one of our key indicators we have there, one of our top 5 indicators is delirium awareness and dementia awareness when an individual is admitted to hospital, to be able to optimize length of stay, prevent deterioration, hopefully get that individual home, because one of the worst places for them is a hospital environment. So a lot of the focus that we're doing there. I'm going to call on my colleagues, but just really thank you for the question. It's something that we do have to really focus on as an organization. So I'm not sure if Dr. Gustafson or if James Hansen wants to make a comment there to add the work we're doing in this space.
Yeah, thank you very much for the question and the concern. I too lost a father who had dementia at the time of his death, and it's certainly very challenging. It was challenging for my family's caregivers as well. Just to say, on the long-term care side of things, we have learned quite a bit in the last 5 to 10 years around dementia and design, and just how we design our facilities to accommodate folks with the dementia. So certainly the building here will have those units built in, and those opportunities will come up. I'm right here. I'm the vice president accountable for community and long-term care, and so I'd be happy to have a real conversation with you about how you can impact what we're doing. Michelle, who's our director of community, is also here, so she can join us and we could talk about the caregiver piece in community. Just a couple of pieces around the long-term care. We too are concerned about the delay. Like many folks, or I guess people impacted by the economy, we have been impacted by construction costs. And so we've had to reset a lot of our current projects just to meet tariffs and all sorts of other things that are going on in the world. So that's kind of where that's at. When we do get to a point around community engagement, we'd love to have you on board to have those conversations about what that could look like.
Thanks, James. Any other questions? As I mentioned at the beginning, as a governance board, we are accountable to you and the people we serve in communities. That's why it's so important for us to provide opportunities like this to hear from you. To those of you who got up and asked questions, thank you for doing that. I hope we have addressed some of your concerns now, and please be assured that we are actively listening to your needs and concerns regarding your health care. I want to thank Marco, Charmaine, Tyler, and Chris for the presentations today. And I want to acknowledge how important it is for our multimedia people to be here to help us hear from people who aren't able to be in the room, but can live stream to hear what our conversation is. And thank you to my board colleagues for being here, and to all of you who came or listened on live stream. We really appreciate hearing from you. Thank you.